Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in healthcare IT. And we're at the Vive 2022 conference in Miami, and we have Jon Elwell. He's CEO at Kno2, and also Therasa Bell. She is co-founder and president and CTO at Kno2. Welcome.
Thank you, John.
Yeah, so I'm excited to have this conversation. We've worked together over a lot of years, but you've made a lot of progress, and Therasa, you were one of the co-founders of Kno2. Tell us kind of the story of Kno2.
Well, I'd say that the story, one, I'm proud of it because it's remained consistent and remained the same since the beginning, but the founding of the company was really based around serving the underserved. So as we looked at the challenge, and at that time the challenge was much smaller than it is today of interoperability. At that point, it was the disparity of communication. So we knew we were going to tackle connecting everywhere in the market that we could, which absolutely proved true. It took us a while to do that because it was such an extensive effort. But we were also going to target the underserved. So we were going to bring healthcare communications. While the whole market was shifting towards where the dollars were flowing with meaningful use with health systems and ambulatory providers, we went the other direction and decided we would focus to building a communication network with post-acute, emergency medical services, behavioral, social determinants of health. Interoperability wasn't even a word in their vocabulary at that time. And
I was going to say.
We chose to go there, and it took a long time to really secure the vendors and the partners and get them to integrate, and we're sitting here today. And because of that effort, we were able to build out a platform that really serves the full spectrum of communication in healthcare, but it was built in such a way to be flexible for those audiences, and then since then really has grown.
So John, kind of tell us, what is the state of healthcare communication today, and what really seems to be preventing broad-based interoperability?
I think you mentioned it earlier when we were talking about evolution. We have a little bit different view. We think there's been quite a bit of disruption. There's a lot of ways in which health information is being communicated. In many cases very effectively, but just too many, right? So for the provider's perspective, they're having to deal with, as you well know, direct secure messaging or carrier quality, Commonwealth, referral networks, HIE connectivity. There's just many, many ways in which information is being communicated today. And unfortunately for the provider, that's a very tough task to understand and to get meaningful results from, right? Because obviously that information is critically important. So I'd say we're still getting there, but it's been highly disruptive. And now in comes TEFCA and QHIN, right? So now we have another way, and I think we can all see that that's likely to have some teeth to it and probably a dominant form of communication over time. But that's all change, and at the same time we have to find a way to calm that down, because what's most important is the provider has the right information. And then patients benefit, cost of healthcare benefits, everybody benefits once we calm that down. So a lot of work to do still.
Yeah, I think some doctors want simplicity.
They do, and they express it very loudly, right? We see it all the time in the communication, and we have to work hard with our technology vendors, because at the end of the day we provide the connectivity, but not the actual user experience. And so it's about the user experience as much as anything. And they have very sound processes in their offices, their practices, their health systems. And so now when there's new forms of communication, how do those dovetail into those practices they're so used to? And those are all challenges that we have to solve on their behalf.
So that was interesting. I mean, you described so many different interoperability options, but it's interesting that you didn't really mention fax. And I mean, fax has kind of a bad rap, but it's also an important piece of interoperability. So what's Kno2's position on fax?
Well, we absolutely embrace fax. We made that decision a number of years ago, and looking at just by percentage, when 70% of your communication, and that's the average across the industry, happens via fax or the fax machine. To say that I cover 30% of your communication, Mr. Provider, but sorry about that other 70% really doesn't work. And we also believe in change through evolution, not revolution. So the change has to come in through a way that they're used to. So by introducing and normalizing fax back into all of the other modalities, that's when we talk about send, receive, find. By bringing it back into all the modalities, that the provider doesn't care at the end of the day. They shouldn't have to care, is this a direct message? Is this a fax? Is this? And we are doing everything in our power to level up the fax, right? To bring it as close to an interoperable transaction as we can. But if we can remove the perception and the view from the provider that they know a difference between a fax and any other type of transaction, that we've done our job. So we believe that is absolutely critical. Embrace it fully. We call it Fax 2.0, actually. So
yeah. Nice. I mean, it was one of my favorite announcements I've seen is, having the technology figure it out, not the doctor, right? Like, you know who has what available, and just use the best possible. I think that was one of the best features y'all have ever released. So.
I think one of the things that was missed in that discussion of facts historically in healthcare is a lack of respect because they've done it so long. They've got a really well organized process. And so change is difficult. I was mentioning that earlier. So they may not like the fact that the document is, it has to be eye-readable. I've got to consume it. It doesn't give the data right into my system for reconciliation, things like that. But you also have to realize it's changing a process. And so one of the things that we do is try to adhere to that thought process and try to mimic not only the experience, but also what's the workflow associated with it, because the office doesn't want a lot of change. So if we can mimic that, it's very beneficial to them.
No, for sure. It reminds me when I first implemented an EHR, I forgot how much was tied to that paper chart being on the door. And we're like, wait, we got to figure this out again.
It's changed.
It's kind of similar. We're used to that fax coming into this folder or whatever.
Oh, we've heard about red, green, and yellow folders. I mean, absolutely, in organizing those faxes. So
yeah, absolutely.
No question.
Cool. Well, Jon, you have something called Kno2 Connected. What are some examples of what this means?
So as Therasa was explaining earlier, what we do around send, receive, find, we take a very pragmatic approach. We license most of what we do to technology vendors. And Kno2 Connected really emanates in two ways. One is that we do not want to take the front seat in front of these great companies that have aggregated amazing customer base in certain care settings. We believe that their technology should take front stage. So Kno2 Connected is a way to validate that we're involved and bring trust to the transaction, because a lot of people know who we are, while at the same time allowing that EHR vendor, digital health platform, patient engagement, whatever it may be, to take the forefront, because they've earned those customers, and now we're just making that experience better. That's one way that emerges. The second way, and it's been really an expansion of our platform over the last couple of years, is what we refer to as connectors. Therasa mentioned something about signing workflows. We do a lot of work with DocuSign, for instance.
Okay.
That's a connector on our platform, and they are identified as Kno2 Connected, again bringing trust into DocuSign approaching a provider with their value, knowing they're Kno2 Connected on a system that is already Kno2 Connected and allows that to work. It's our own version, kind of thinking like Bluetooth, right? Allow that standard to bring trust, and then allow participants to take existing technology and benefit from it. So it's worked quite well for us, and we continue, like I said, to really value the companies we partner with to be the lead. It's their customers, it's their effort, it's their technology that garnered the universe. We're just there to help make it work and create that trust around communication.
Yeah.
And I would just add to Jon's comment about Kno2 Connected, because of the way that the send, receive, find APIs work, we're not tightly bound to a data model. And so the partner community, the ecosystem in who we attract is limitless. And we're not, only pop health vendors, or we're not only patient engagement or EHRs. I mean, we're sitting on literally fax machines because of the way the consumer APIs, we're there with one, plugin of a license key. They're now dynamically connected to the EHR. They can send to the community, and now they're part of the healthcare ecosystem, right? We can go from that to one of these discrete data platforms. We can move into a VBC platform, a pop health platform, because the APIs allow for that kind of flexibility across these different technology platforms. So what it means to be Kno2 Connected, it's really the experience of the user engaging with whatever that application is, whatever the device is, whatever it may be. That's what it means to be Kno2 Connected, is their experience with that particular interface.
Sounds like Intel Inside, but for interoperability in healthcare. So Kno2 Connected, very interesting. I like it. So Jon, you mentioned the buzzword of interoperability right now, I think, which is TEFCA, right?
Yes.
It's out.
Yes.
We finally know what it means, at least to some extent.
Yes.
What do you think the impact's going to be of that legislation, that rule, and will Kno2 connect as a QHIN?
Great question. We have, and we've been public with this, that we have every intent to apply to be a QHIN. We respect the process. We think we're well positioned, but we have every intent to be a QHIN as long as we get through the process. We see that, I mentioned that earlier in one of the questions you had asked, that we continue to see this disparity in communication preference. I mentioned chaos to calm for a reason. It's kind of how we view it. that if we become a QHIN, which we fully intend, all of our partners and those that have integrated to our platform have the ability to migrate, right? So as direct secure messaging potentially declines, or some type of query-based exchange declines, or fax declines, let's hope, they're not having to worry about change on our platform. It's just another way to send, receive, find. So it's a really important initiative, and it's really important that we support the industry migration. Because as you know, there's billions of transactions going across these networks today. We've become comfortable with them, and now there's a new way to do it. So our view is that if you think send, receive, find, and not about the actual protocol or network that it's occurring over, or the standard in which it's using, we help the provider, which means we help the patient, we help overall healthcare. So we're pretty passionate about that topic, and are very anxious to help the community make that transition.
Yeah, I'm interested to see how it evolves. I mean, and will direct keep going, and QHIN will one fall with the other? I mean, but I like it. It doesn't really matter.
Yeah, we don't pick winners and losers, right? Let's just support them all,
right?
And then let's make sure that whatever emerges is supported well. I think that's the best thing we can do for the community.
So where can people go to learn more about Kno2?
I would absolutely say come to our website. Tons of education on the website and educational resources. You can understand who the company is, but just as important is we're a very accessible company. So you can reach out to anybody within the organization, including myself. We're going to respond. We are very mindful of making sure that we're available to any type of partner, any type of end user. We're serving the entire healthcare ecosystem. So please contact us.
Awesome. So they can just check it out at kno2.com.
Yep.
Yeah, I think that important to the audience that interacts with you, John, that we do not base our engagement based upon size or importance. As I say to the company all the time, we wouldn't exist today if others weren't willing to invest in us early on when we were a very small company.
Right.
So as I say, who knows who's going to be the next Amazon? Who are we to pick and choose, right? So for those that are interested, we are here to help everyone. If you have an interest in getting into the space, you have a great idea like Therasa had over a decade ago, or if you're well-worn and very successful in the space, we're there to help support it. So I want to make sure that everybody's aware that as you approach us, we help support everyone. Really important to us.
That's great.
Yeah.
Well, thanks so much for sharing all the insights and perspectives about Kno2, and thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com.